Hi everyone. Evening.
Hello?
Hi, Timothy. Sanjeev here.
Yes. Yeah, okay.
Are you on?
Yeah, I'm on. You started the live, is it?
Yeah, started already.
Okay, coming.
So we'll wait for everyone to join in. Hi, Mika. So good evening, everyone. We're going to be starting soon. We're just waiting for our guest to come and everyone to log in. Hi, Timothy. Hi, Timothy.
Hi.
Evening.
How are you? Yeah, evening. How are you?
So, guys, we're just going to wait another 2 minutes for everyone to join in, and then we're going to start. Yeah. Hi,
You
everyone.
are now in office?
Yep. So you're live now, Timothy?
Yeah, I know.
We'll start in about 2 minutes, yeah? Hi, David. Hi, Raza. Thanks for joining in. So guys, this is part of the Rampal Surgery series on Instagram Live. Today we'll be talking with a colleague of mine, a good friend of mine, Dr. Timothy Cheng. He's an orthopedic specialist, and he'll be talking to us a little bit today about fitness during the pandemic. We'll start in exactly 1 more minute. We'll just wait for other people to join in. Hi, Sophia. Thanks for coming. Fikri. So we're just going to wait for 1 more minute. I'm going to start, yeah? Okay, I think we're going to start first. Yeah, thank you everyone for joining us on this warm afternoon in Kuala Lumpur. I'm Dr. Sanjeev Rampal and from rampalsurgery.com. And today we'll be doing the Instagram Live. We'll be talking about publicly related and also this. Today we are fortunate enough to have a good colleague of mine. His name is Dr. Timothy Cheng. He's an orthopedic specialist and also a member of the Malaysian Medical Association SCOMOS chairman for this year. And he'll be talking today about a little bit about maintaining fitness during the pandemic and also how to prevent common injuries during the pandemic. As we all know, that the pandemic has resorted us to be in different conditions like normal, and we are exposed to a reduction in our physical activities by limiting our outside exercises, and a lot of people are doing work from home, so everyone is exposed to exposed to working online. Some of them more than 8 hours to 9 hours on the computer at different postures. So yeah, so we are exposed to different environment, and this predisposes us to certain kinds of injuries. Today we'll be talking a little bit more about that. So without further ado, I'm going to introduce Dr. Timothy Cheng. Right, so Dr. Timothy Cheng is an orthopedic specialist. I'll just let him intro himself. So Dr. Timothy Cheng, thank you so much for joining us today. Would you like to introduce yourself and maybe give us something of what you're interested in?
Hi. Thank you so much, Dr. Sanjeev. It's great to be here. I am actually currently in Sandakan now. I just reported for duty here as orthopedic surgeon. Just finished my orthopedic surgery training in University Malaya not too long ago, actually. Very interested in functional fitness. I have a CrossFit Level 1 certification. I've organized a few fitness events, both in Sabah and as well in back home in KL. And I guess functional fitness is something very, very close to my heart and something I think everyone should be participating in. And this is different from the conventional bodybuilding gym kind of thing. Rather, functional fitness is more on moving and keeping your body moving, no matter how old you are, regardless of your age, your gender, physical ability, in fact. Yeah. So I think it's something that we all should be taking part in. Yeah.
Yeah, Dr. Timothy, how long have you been involved with this, and do you plan to continue in this field?
Yeah, so I started this functional training. Actually, it was a JKN Sabah initiative, and this was 2017. They had some sort of khusus pengenalan or introductory course to it, and it was great. It's actually known to many people as CrossFit. That's just a brand, but the basic concept is a functional training. Yeah.
That's fantastic. So, now that we are in the pandemic and, all our patients have been exposed to different environments, as I described just now, would you like to give us a guide on how to maintain fitness during the pandemic?
Okay, now, so the thing about the pandemic is that we're all at home. Okay, so, and depending on SOP, whether you can go out or not. Now, I think if we can go out, the best thing is to always go out. We need sunlight, we need fresh air, not just to feel better, but sunlight actually gives you vitamin D. So yeah, so I think if SOP allows, I will encourage everyone to get out of the house. You should be out of the house if you can at least once a day. You don't have to do a 20-kilometer run, even a 1 kilometer walk around a park alone will be a lot better than sitting at home.
So what do you suggest the people do while they're in the pandemic? So there's different environment, and some of them are not allowed to jog around, go outside their house in certain places, especially in certain places in the Klang Valley. Yeah. So
Yeah.
what do you suggest do?
Yeah. So with regards to going out, if you can find, just touch a little bit more about going out. If you can find a slope or a hill to walk up and down, and if your joints can take it, this is also a little bit better than walking on a flat surface because it encourages weight bearing on your joints, and also for bone density as well. So if you can't go out and you live in a condo or high-rise building, you can take the staircase. Now, taking the staircase also has a lot of benefits, especially for your bones and joints and muscles as well. Prevents sarcopenia, prevents osteoporosis. Even a simple staircase climb can make it a lot.
So,
Can be very difficult. If you can do it easily without a weight, carry a backpack. Put in a few bottles of water, weighted, go up and down. Yeah.
yeah.
If
So
your joints are painful coming down, take the lift down and walk up.
Yeah. So cardio and resistance training, I guess, right? So
Mm-hmm.
that comes up to the next question. What are the normal injuries that you see during the pandemic? Like there are different types of injuries. What are the different kinds that you would see, and how would you go about preventing or telling our patients to prevent
Yeah.
this injury?
So the thing about a lot of these exercise programs is that you go on YouTube, you Google the first thing and you search, the first thing you see is some high intensity exercise, and somebody all dressed up is doing everything with music, and then you just go full on and start doing half an hour of something that leaves you completely like half dead. So I think you're going to be really careful, and you got to ease yourself into something, especially if you're not used to doing something that is high intensity, that it's of high intensity. So always take it slow. Cut it half, 50% of what you're doing. It doesn't have to be the weight. It can be just number of reps. So if you're doing like 20 reps, maybe just do 10 or 5 and see how you feel over the next 2 days, and then do it again. If the workout lasts 30 minutes, maybe just do 10 or 15. Make sure you warm up properly. Warming up doesn't have to be a full half an hour stretching thing. It can just be 5 minutes of stretching. Make sure you stretch every part of the body. A bit hard to demonstrate now, but there are many resources online to show you how to stretch. Some light jumping jacks, jump ropes, just to get your heart rate up before you start the actual workout would also help a lot. If you have resistance bands, those elastic bands you can use to stretch. Also very good. I in fact use resistance bands in my warm-ups even until today. I spend 5 to 10 minutes just using bands on all the joints to make sure they're warmed up. Yeah.
Yeah, there's a new term. It's not a new term, but in orthopedics we call it the weekend warriors. Yeah. So would you like to tell our audience what's weekend warriors and how to prevent that?
Yeah, weekend warriors are generally those that, well, for most office goers in the corporate world, perhaps with a busy desk job, you tend to only exercise during the weekends, and this also can leave you quite injury prone because during the day or during the week, Monday to Friday, you're generally a bit more sedentary, and Saturday, Sunday comes and you do this long 2-3 hour workout that can leave you quite tired. Yeah, so to prevent that, you either find time, if you can, work out during the week. And this doesn't have to be, I find a lot of people say they don't have time during the week, like Monday to Friday, to actually work out. But that's, I think everybody does have time, and you don't have to spend even an hour. Okay, so even like 15 to 20 minutes or half an hour would actually be quite beneficial for you. You don't have to spend a long period of time, and you don't have to do everything in one session. So if you don't have time today, you can just do 20 minutes of stretching or mobility work, and that is fine. You don't have to do stretching and strength training and cardio, and you squeeze everything into one half an hour session, you end up, rushing. Just pure stretching, if you have some, basics of yoga, Pilates, just do that for one session and go to sleep, rest. You wake up in the morning, maybe half an hour earlier, and then do maybe some squats and burpees, and then rest. So every day is a different thing you do, and this will help this weekend warrior syndrome.
Yeah. So actually, they don't really understand the term weekend warriors. Would you like to explain to them?
Weekend warriors, yeah. So at least from what I understand, is this people that only exercise during the weekends and therefore get injured, injury prone because they only only focus on exercise during the weekend. So again, like what I suggested is to move some of that workout to the weekdays, because that will help. Yeah. And of course, if you're going to do a long workout on the weekend, you really better warm up properly, rather than just jump into it.
That comes up to my one of the last questions is like, now how would you treat it? Because not all injuries end up like, you know, having a tendon tear or some form of severe injury. So some mild you know, wear and tear of the muscles is expected. So what would you recommend them to do before maybe seeing a doctor, you know?
Well, so if you have an injury, I mean, I think I myself have multiple, you know, sprains and strains over most of my joints. So before you see a doctor, what you can do is, number one, to rest it. There is a move, the school of thought, from putting ice to actually heat therapy rather than ice, because they've shown ice therapy has shown not to really work. If you look up the sports medicine journals, they'll tell you a bit more about that. And I think as we progress into exercising and not really this, you know, not necessarily for those who are elites, but even for any recreational athlete, we need to know our body. So if you find, say for example, the simple push-up, if a wide grip push-up gives you pain on your shoulder or chest, and you find a narrow grip push-up works, then you need to modify that and do a narrow grip push-up. So I was just talking to a friend today who was telling me about his shoulder pain. He says he can do presses horizontally, but every time he does incline or overhead, he starts to get this pain. So I feel that I told him, so then for the next 6 to 9 months, perhaps just stick to horizontal presses. I had problems with lifting the bar with my hands wide apart, and I realized that if it's neutral, already narrow, there's no pain. So this, you must know your own body, because everybody's injury is going to be different. If you find that, you know, a full squat gives you pain, a half squat has no pain, then work on the half squat, because you don't want to completely not squat at all. Then you start, you know, losing the strength in your legs. So do the half squat, maybe increase the weight for the half squat instead of doing a full range of motion. And as the pain goes away, then you slowly bring the range of motion more and more. So the idea is to really know your body and to focus on a movement one by one, rather than, okay, today I'm going to do a squat, a pull, I'm going to run, I'm going to jump, and then tomorrow you got pain everywhere. You don't know which movement caused what pain. So stick to just one or two movements that day, and then see the next few days whether your pain has increased or decreased. And if it's okay, then keep going on the same movement. You either increase the number of reps, so maybe 20 repetitions to 30, or the weight. So if you're doing 5 kg, maybe try 6, try 7, and you will find that just sticking to this no pain-free range of motion or pain-free repetitions, you will actually strengthen the muscles around the joint, and that actually prevents injuries. Of course, warming up and cooling down, that you know, that goes without saying. If you don't do that, then you're just asking for trouble. Oh, Arvin is here. Yeah, he is a lot more qualified to speak about this, actually. A sports med physician who just graduated. Maybe you can get him next session to ask Arvin to come on.
Why not?
Who has very, very extensive knowledge on anything spontan related, actually. Especially the journal articles and systematic reviews. I think he's listening to me now. Okay.
So Timothy, would give them a take-home message?
Take-home message. Okay, so number one, for those of you who are just starting out, go slow on yourself. Give yourself time to breathe. Don't push yourself. Don't expect results within a week or even a month. Okay, it may take up to 12 months before you actually find yourself getting comfortable. And results are not necessarily, okay, today I can lift 10 kilograms. Next year I can lift 100. But if you can move the same, say today I can lift 20 kg. In 6 months I can also lift 20 kg, but it feels easier, your technique is better, you can do it more times. That itself is an improvement. And the right technique is a lot more important than lifting heavy weight. So make sure you have, at this time, at least an online coach, somebody who knows what they're doing. These are for beginners. For those of you who have been already doing it, intermediate and advanced athletes, please carry on. We do not know how long this pandemic will last. You know, encourage each other. Find a friend that may need some pushing along as well, and give them the motivation they need to continue.
All right. Thank you so much, Dr. Timothy. It was great to have you. And we look forward to having you back again probably later in the year. All right. Thanks again, Dr. Timothy Cheng. He's an orthopedic specialist around here and in KL region. And I'd like to thank everyone. We're having another session on Friday at 5:30 where we'll be joined with Dr. Anand from Colombia, Asia, and we'll be talking about hypnosis as a way how to use it in pain relief. Yeah, it's a new technique. All right, hope to see you all. Thank you so much, everyone, and bye-bye, and have a good holiday. Selamat Hari Raya Haji to all the people celebrating.
Yeah, Merry everyone. Take care.
See you.